Welcome to the presentation on ranges of movement and also planes of motion. In this presentation, we're going to look at how our joints move in different ranges and the names of those, and also the terminology for the planes of motion as well that movements can occur. It's important to understand the terminology we use for different ranges of movement for writing up our client's notes. And let's start by looking at the neck. So here is rotation. So rotation to one side, or you can do the other side. Into lateral flexion, which is a side bend, ear to shoulder. Neck flexion, which is chin drawn down towards the chest. Neck extension, where chin lifts towards the ceiling. And next into the arms, the glenohumeral joint. We start with flexion. Arms reach towards the ceiling. Into extension, which arms are taken behind. Abduction or abduction is arms open away. So abduction is taking away. Adduction is bringing the arms together. So adducting, adding together. Horizontal flexion comes across the body horizontally. And then horizontal extension is the opposite, so going across the body away. And these are both also known as horizontal adduction coming in and horizontal abduction going away. Circumduction is all of the movements at the glenohumeral joint together in big circles. Next is the shoulder, where we look at the scapular movements. So we start with elevation, shoulders raised up. Depression is where shoulders lower down. Protraction, they come forwards. And retraction, go back. Into external rotation, so externally rotating outwards. And then internal rotation, the opposite, rotating the arm inwards. And we head into the spine. We start with flexion, taking the body forwards, into extension, opening out and backwards. Lateral flexion, so moving down towards one side, laterally flexing over that one side. And rotation, twisting from one side to the other side. And now we'll look at the elbow. We have flexion, so arms coming up. And extension, arms lengthening and opening downwards. Into the wrist. We have wrist extension, hand lifts upwards. And wrist flexion, hand draws downwards. Supination, so palm turns up like holding a bowl of soup. And pronation, arm comes down. Into the hip. Hip flexion, leg goes forwards. Hip extension, leg extends behind. Abduction, leg goes away to the side. Adduction, leg comes inwards, adds together. External rotation, leg opens out at the hip. And internal rotation, leg rotates inwards at the hip. And next is the knee joint. We have knee flexion, knee bends, and knee extension, knee straightens and leg straightens into the foot and ankle. We have Dorsi Flexion, toes lifted up. And we have Plantar Flexion, toes pointed. Then we have inversion, foot comes in, and eversion, foot goes out. Pronation, arches drop inwards, and supination, arches drop outwards. Next we have the planes of motion, so the different planes that we can move and joints can move. So we begin with the frontal plane, and that's a sideways motion, so from one side to the other side. If you imagine you have a plane of glass in front and a plane of glass behind, and you're moving without touching it, that would be the frontal plane. Next is sagittal, and that's going forwards and backwards. So spine flexion and extension is an example of moving in the sagittal plane. And then we have the transverse plane, which is rotating or twisting in each direction.